on behalf of the School of Public Health and Preventive Medicine, the Central Clinical School and our precinct partners, the Baker IDI and Burnett Institute, I'd like to welcome you to this Honours Information Night. Well done on giving up your Thursday evenings or Thursday evening and spending it with us, and hopefully we'll be able to provide you with a nice overview in terms of why you should be doing honours here with us at the AMREP precinct next year. So this is a schedule of events. Obviously the first part has been done and dusted. So we're just going to run a 30-minute overview in this session from a few perspectives in terms of what it's like to do honours here at the AMREP precinct. So I'll probably talk for a few minutes just to give you a bit of an overview in terms of the precinct itself, and then I'll hand over to Nadia, who is a recent honours graduate, and then I'll hand over to one of our honours coordinators, Dr. Joe O'Toole, to give you a sense of, or to give you an idea in terms of the nuts and bolts of the application process and how things operate here. Like I mentioned, 7:30, we're all being treated with pizza. So we're not only feeding you, but please use the opportunity to touch base and introduce yourself to all the researchers that are currently out there in the seminar rooms and the meeting rooms. They don't bite, even if they've got scary names like Dragan. You know, we're fairly nice people, and it's probably one of the rarer opportunities that you get to meet researchers and potential collaborators, potential supervisors, and even potential employees in such a relaxed environment. So I'd encourage you to make the most of this opportunity. So as I mentioned, my name's Dragan Illic. I'm the head of our Medical Education Research and Quality, or MERQ unit, over at the School of Public Health and Preventive Medicine. I'm also the Director of Teaching and Learning, so if you've got any other, I guess, questions relating to education, broadly speaking, within the school, I'm more than happy to take your questions. So one of the big things and one of the big features, I guess, or selling points of doing honours here at the AMREP precinct is this notion of us being a leader in the field of translational research. So hopefully everyone's heard of translational research. If you haven't, it's essentially, I guess, defined by this notion of doing research at the bench, translating it to the bedside, and then moving it beyond. And that's one of the strengths being located here within the precinct, having access to a 600+ bed hospital, being a teaching hospital and a clinical research site, that we've got this ability to actually do translational research. Clayton's a wonderful campus. There's wonderful research being done there. I was there this morning. It was fantastic. But there's always this pull to come back home, so to speak. I joke. But the advantage that we have is that we have this ability to be translational. So no matter whether your interests lie in the basic sciences, so if you want to work in a laboratory, we've got that covered. If you want to progress to the bedside component, that is, you want to be working along patients, having that patient contact, we've got that covered. The beyond aspect of translational research as well. So moving beyond the bedside into larger populations, working with registries, looking at the population and what impact it has there, we've got that capacity. So again, I think we're in a really unique position that we can pretty much handle any interest that you may have in terms of doing an honours project here. In terms of the types of, or the areas of study, I think I'm fairly confident when I say we've pretty much got it all covered here. Well, a bit of a rider there. We've got it all covered, apart from obstetrics, I should say, gynecology and paediatrics. So if you're interested in that, you're probably wasting your time being here. Enjoy the pizza, but you're better off down at Clayton for that. Apart from that, we've got everything else covered. And it's not just in one particular school or one particular precinct partner. So as you can see here, The School of Public Health and Preventive Medicine, we obviously have a specialisation in clinical trials, epidemiology and biostatistics, but we also cover aspects such as infectious disease, occupational health, environmental health, musculoskeletal research. Have a great collaboration with the intensive care unit. Got a world-renowned critical care unit at the school. Obviously at the Baker and IDI, they've got a specialisation in cardiovascular disease, diabetes, and whatnot. Burnett, world-renowned in terms of infectious disease, global health, and research topics that affect young adults, and you know, they've got a couple of really catchy titles there. And then obviously we've got the Central Clinical School with their vast ties to the clinical aspect and the clinical arms within the precinct itself. So much like the School of Public Health, the Central Clinical School has got access to you know, a variety of clinical disciplines, some that overlap with others, others that are truly unique. As I mentioned, the great benefit in being here at the AMREP precinct and in a teaching hospital environment is you get access to not only national but international respected clinicians and researchers in their fields. So again, I'd implore you to make the most of the opportunity to touch base with these people out there whilst we're having our tea, and introduce yourself and try and get a sense of what you may or may not be interested in. So in terms of some nitty-gritty, if you want to do honours within the School of Public Health, Joe O'Toole, Professor Alan Cheng, who's not with us tonight, but Joe is, and Dr. Darshini Aiton, they'll be able to assist you, and Joe will talk about the process in a few slides' time. From, I guess, a university or a faculty point of view, if you have any interest in doing an honours project in immunology, regardless of whether it's based here, whether it's based over at Clayton or any other site associated with Monash University, you need to enrol through the Central Clinical School. Similarly, if you've got any other interests, I guess in a clinically related field, whether it be neuroscience, surgery, diabetes, etc., you can also enrol through the Central Clinical School. Their coordinators aren't here tonight, but Mark Wright is standing in for them, so he's also available outside, so please make yourselves known to those people. So this is the point of the night where I try and sell to you why you should also come to the AMREP precinct, not only because it's such a wonderful intellectual site, you've got wonderful national and international clinicians and researchers, but you're in a nice area of town as well. You've got the Albert Park, stone's throw away, Chapel Street, about 800 metres, so you can get your lattes, do a bit of shopping. South Melbourne Market, Paran Market, about a 10-minute walk away. Fresh food, you can also park there fairly cheaply, so if you're wondering about how to get here, easier to drive. Got a number of trams out the front. Greville Street, you've got your trains. Just brilliant, and as you can see up there, we've got the AMREP precinct. So all in all, I mean, I love coming to work here. I really enjoy it. Contrast that with Clayton. Well, I'll leave it up to you to decide which offers better scenery or more inspiring. Lots of factories, lots of construction, lots of grey. It's always cold in Clayton for some reason. It's grey, it's windy, it's rainy. I was there this morning and I was freezing. I came here and there was sunshine. You know, you know, it's not all about just doing your work. There is time to enjoy yourselves as well. So I just want to spend a couple of minutes talking about the School of Public Health, and then I'll hand over to Nadia. So some of the questions that we answer at the School of Public Health, and sometimes I don't think it's well known that how sort of broad the topics that we cover at the School of Public Health are. So they range from, like I said, every range of that translational research continuum, whether it be at the bench with basic research, bedside or beyond. So these are a couple of examples. We've got projects around critical care. So how do we best treat severe head injuries to prevent long-term brain damage? So like I said, we've got a great critical care unit. Just a few years ago, when we had the Hazelwood fires, we've got a large longitudinal study looking at the after effects of that fire down in Gippsland, seeing what effect it's had upon the local community. That involves not only clinical aspects, but the social sciences, so getting to interview people, seeing what effect it's had on their quality of life. Environmental health, we've got an internationally renowned environmental health unit here at the School of Public Health and Preventive Medicine. So I think everyone's got one of these. I've actually got it placed here, so I don't know how good it is, but you know, do mobile phones, have they got any adverse events? What was that? You know, guys in particular were freaking out at one stage because if you're a guy, you're tempted to put your mobile phone in your pocket, and it's sort of, well, you can put two and two together. So they're the types of projects that we do. We've got women's health, a very controversial topic around screening for breast cancer, infectious diseases. We had the Ebola outbreak a few years ago now. Staff members from our particular infectious disease and modelling unit were directly involved with that Ebola outbreak in terms of preventative strategies and trying to manage it. Patient safety, so we're obviously tied in with the hospital. Our clinicians are wonderful, but obviously mistakes are made, so how do we minimise mistakes to ensure patient safety? And one of the things I think that is a gem with the School of Public Health and Preventive Medicine is our affiliation with the Victorian Institute of Forensic Medicine. So for all of you who are interested in CSI, come do your honours project with us. You've got access to all the staff over at the Forensic Institute. You know, just a few years ago, they were involved with trying to identify whether Ned Kelly was actually buried where he's supposedly buried. So in terms of the program at the School of Public Health, we have 3 streams. So we've got the Bachelor of Medical Science, we've got the Bachelor of Biomedical Science and the Bachelor of Health Sciences. So even though we've got 3 streams, we try and we tend to cater it as one large cohort of 30 to 40 students. So by all means, you're not going to be isolated in doing your research project. You're part of a bigger group. Whether it be just at the honours level, but we've also got well over 170 odd PhD students based at the School of Public Health. So you're part of a large community and you have the benefit of conversing with each other and seeing where your career pathways may take you. Why should you do honours here? Well, I won't go through these slides, but I will encourage you to grab one of these booklets. So there's a number of booklets out there. This one's the honours booklet for the School of Public Health and Preventive Medicine. And I sort of tried to put myself in your position. And if I was an honours student or potential honours student, what sort of projects would interest me? So I've looked at the clinical epidemiology division. Does the structure of the spine matter in lower back pain? Okay, so a bit of a clinical project there. Critical care. Drug and alcohol use in non-traffic trauma deaths. Health Services Division, women's experiences of medical tourism. Geez, that's interesting. Prevention science, the cost effectiveness of tumour-based genetic screening in the Australian population. So again, something a little bit different. Right? You're not looking down a microscope trying to differentiate your mitochondria from your whatever else. And then the Burnett Institute, sex, drugs and rock and roll, young people and risk behaviours. So not your standard projects is what I'm trying to get at. We don't only have quantitative projects, but we also have qualitative. So projects that you go out there and you meet people and you talk to them and you have a conversation and you analyse the data from that perspective. I think I've talked way beyond my time, so what I'll do now is introduce Nadia, who's a recent student who's just completed her honours, and she can talk to you guys about her experience in honours.